I spent about 5.5 weeks in Sierra Leone in Kenema district. I was a health promoter for the CDC, working to disseminate key messages about Ebola to support the social mobilization and psychosocial efforts within the district. By the time I arrived in Kenema Hospital, over 20 nurses had contracted Ebola and had died at that point. So I immediately realized the importance of supporting the staff who are there, who have been working day in and day out from the very beginning, who needed their own psychosocial counseling in order to move forward in their own care. So I worked with the psychosocial team at Kenema Hospital, and we created a space for the health personnel to receive counseling, and also for the survivors of Ebola to receive counseling. We also worked in the communities in Kenema district in order to support families who had been quarantined. We actually came upon a woman one day who had lost 10 members of her family, and 2 of them had died that very morning. You know, it's a strange situation to see that much pain and suffering and to not be able to provide a hug or comfort in that way. But it's important in a situation like that that you maintain distance and you just provide counseling and support in other ways. In the Ebola treatment centers, they have access to personal protective equipment, similar to that which is used in the United States. However, some of the issues that they had was getting supplies into the country due to a reduced number of flights into the country. So getting supplies in was definitely a challenge. They did use personal protective equipment, but there are not enough staff to take care of the Ebola patients. And so staff oftentimes worked longer hours than they should have, and kept coming day after day, putting their own lives at risk, essentially.
Michelle Dynes, you told a story on Dave Isay's wonderful StoryCorps recently about what happened to a woman who brought her baby into a hospital. Can you describe that story?
Shortly before I arrived in Kenema, a woman had come into the treatment center sick with Ebola, and she had brought her baby with her. The mother, unfortunately, tested positive for Ebola, but the baby tested negative. In a situation like that, it's very, very difficult to know how to move forward with the care of the baby, because we know as healthcare providers, as public health professionals, that the risk of that baby becoming Ebola positive is quite high. We know that the Ebola virus is found in breast milk, and that baby was breastfed. And so in that situation, the hospital staff chose to keep the baby in their presence so that they could monitor the baby for symptoms of Ebola, especially since the baby had tested negative initially. Unfortunately, over time, the baby did develop Ebola, and those hospital workers had all placed themselves at risk by caring for that baby. It's the humanitarian side of all of us that reaches out and says, you know, we have to pick up this baby and take care of it, even though you know you're at risk.
What happened to the nurses and doctors that cared for this baby, cuddled this baby?
There were several nurses who contracted Ebola as a result of contact with that baby, and unfortunately, many of them died since that time.
And the baby?
Unfortunately, the baby also passed away. It's, you know, Ebola is a very, very difficult disease to treat. We can provide supportive measures, but in many cases, the body is unable to mount an effective immune response, and that baby succumbed.
I am sure many people who are watching this broadcast, Michelle, are consider you a saint. You went to Sierra Leone when all of these nurses died, not to mention many of the people they treated. How did you protect yourself? You know, right now there's two major issues in the world. ISIS, the whole discussion, boots on the ground, boots on the ground. But what about medical boots on the ground when it comes to Ebola? What it would mean if tens of thousands of people like you in this country and around the world provided help and care in places like Sierra Leone and Liberia. But first, how do you protect yourself, and what would that look like if people actually responded in this way?
First, I want to make it clear that my role in Sierra Leone was not as a nurse. I was not providing direct care to patients. I was there in a health promotion role, trying to make sure that communities were educated, that healthcare workers were properly trained. So being at Kenema Hospital and in that environment in general, we did take measures every single day to protect ourselves. There were buckets of chlorine water to wash your hands as you entered pretty much every building in the hospital. We used chlorine wipes to wipe down surfaces to protect ourselves. There were even roadblocks to prevent people coming in and outside of Kenema City and Kenema District to make sure that people did not come in or leave with a fever. So there are many, many ways that we were protecting ourselves. And for those who have considered going to help, those measures will continue. And you are there to help others, but you can't help others if you yourself become ill.